I'd like to welcome everyone to our first open enrollment webinar. We appreciate you taking the time to let us talk to you about the upcoming open enrollment. As Hannah mentioned, she's the moderator for the Q&A. So if you have questions, feel free to post those in that Q&A, and Hannah can let me know if there's an answer that she needs to give back. If it's a detailed question and you have more personalized information that you're needing during the presentation, you're going to see the ways that you can reach out to us to get a more individualized information, one-on-ones or calling the customer service desk. So we have several options for you. So don't feel that you're not going to get your questions answered, because that's what we're here for. So let's get started. Here is our new 24-25 benefits open enrollment. So this is your decision time. If you've been thinking about maybe making some changes to your benefits for the new fiscal year, then now is the time to do so. Just a reminder, the fiscal year starts on July 1st, goes through June 30th. Decision time, open enrollment officially begins Monday, April the 22nd, and is going to go through May the 3rd. The portal will have an open enrollment link. Remember that if you do make a change, you should get an email to your UK email that lets you know that a change has been made. Don't forget to review, submit, and save. I want to mention that straight off the bat. So this is your 1-year opportunity to change your health insurance, your dental and/or vision. It's also the time for you to add or re-enroll in a flexible spending account. It's also your chance to add more coverage, such as legal services, life insurance, and short-term disability. If you are happy with your current plans, no action is required on your behalf. Everything will continue on as is. Again, the only exception is if you wish to participate in the flexible spending account. This year's rates, as you probably have heard and noticed and seen in the documents that have been sent out, are increasing. And this is a reflection on the rising health costs nationwide. And it is also based off of increased overall claims. The rates bring our plans in line with the true cost of insurance for insuring our faculty and staff. UK is administering through their budget an additional $40 million to go towards those overall costs, so that it helps minimize the impact on our employees. Monthly employee premiums for employees are going to increase, as I mentioned. Smaller increases to the HMO and the saver plans. The monthly rates for dental and vision, they will remain the same, so no changes there. And there's not going to be any reductions in the benefits. So the costs are not increasing and the plans changing where you have less coverage. All the plans are staying exactly the same. Access to care. UK Healthcare is working quickly to increase access for primary care. Here are some options for you. UK Healthcare Hamburg, that is scheduled to open in May. It's going to have adult and pediatric care. Employees are going to be given the first opportunity to schedule appointments before introducing the location to the public. Frankfurt Clinic, scheduled to open in fall of 2024. Madison Clinic, fall, winter of 2024. And then we have a Fayette Clinic that we're going to be getting some updates about that coming soon. So be on the lookout for that. Access to care, additional, we have the Team Blue Clinic for primary care. We have UK Healthcare Urgent Care Clinic at Turfland and Fountain Court. We have Employee Urgent Care at the University Health Services. We have Live Health Online, which is available on any plan. And then we have the Anthem 24/7 Nurse Line. So a lot of options there for you to be able to utilize your health insurance. Now comes the important decision. It's not one that we can make for you, but hopefully with the information we're going to provide, it's going to make you feel more comfortable with making that decision for both yourself and your family. So choosing the best plan is going to depend on what your needs are. If you have questions, we know this is an important decision, so we want you to be certain that you're comfortable with those decisions that you're making. And how we can help you with that is that we do have information on our website. It's the open enrollment website. It's listed here. We also have our benefits customer service. The numbers indicated there, the 859-257-9519. It's option 3, then option 1. We have our benefits email. So this is like our hub for benefits questions. That is monitored daily. And if you have questions, sending forms or documentation, don't forget, if you're adding anyone on your plans newly this year, we will need the appropriate documentation. That could be a marriage license, a copy of the most recent tax return for a spouse, birth certificates for children, sponsor dependents. We would need proof showing that you've shared a common residence for the previous 12 months. You also have the option that's just new this year to schedule a 15-minute individual consultation if you need support beyond today or an initial call or email. I apologize, my voice is going out on me. Other ways that we've had to help employees with their benefits is the webinars, which is what we're having now. We have another one scheduled for April the 23rd from 3 to 4 p.m. We have 10 open houses to meet with benefits and other vendors. You can see our website for the dates and locations. And then we have virtual open houses with breakout rooms for benefits and our other vendors. That is noon to 1 p.m. on April the 24th. There are differences in how and when you pay your costs on your health plans. Some of the terminology that you may hear come up against is premium, which is the amount that's deducted from your paycheck. Deductible, that is the amount that you're responsible for before your plan begins to pay for some services. Copay, that's the amount that you pay for a particular service. Coinsurance, that's the percentage of the cost you pay for a service. Some plans have lower premiums and higher deductibles, while other plans have higher premiums and lower or no deductibles. Each plan also has an out-of-pocket maximum, which means there's a cap to how much you're going to pay during the plan year. Once you meet that out-of-pocket maximum, then the plan comes in and pays at 100%. Wanted to mention that just so it's not confused with the deductible. We have our Saver plan, which is a fairly new plan. It is a high deductible health plan. That means that it can be partnered or it's combined with an HSA account, health savings account. You have the flexibility to see any provider in the Anthem network. but your deductible is lower if you see a UK healthcare provider. If you use UK healthcare pharmacies, your out-of-pocket prescription costs will be lower as well. With the Saver plan, you'll cover healthcare and prescription costs out of pocket until you meet your deductible. Then the insurance begins to pay a portion. UK will contribute to your health savings account to help bridge that gap. You also have the ability to contribute additional funds to your health savings account, and that is done on a tax-free basis. In the chart on this slide, you can see that if you have employee-only coverage, UK will deposit $1,000, and that is done over 2 installments. Half of that July 1st, the other half January 1st. If you have anyone on your plans other than yourself, then the university will deposit $2,000. That would be $1,000 in July and $1,000 in January. Notice that the deductibles are changing this year. For employee-only coverage, it's $1,600. Coverage with family members is $3,200. That's when using a UK healthcare provider. That additional money that you can contribute on your own to that HSA is a maximum of $3,150 for individual coverage, $6,300 for coverage with dependents. The plan includes an out-of-pocket maximum, $3,000 for individual coverage when seeing UK healthcare, and $6,000 for coverage, including family members, when seeing UK healthcare. So if you're thinking about choosing the Saver, you'll want to consider that you're able to pay your medical and prescription costs out of pocket until you meet that deductible. This is also a good option if you're looking to save money for your medical expenses later in life. Here's a little example for someone that chose the Saver plan. Health conditions are good overall, expects few medical and prescription costs, lives in Bowling Green, works at the College of Medicine Bowling Green campus. And what Leo likes about his plan is that he can cover the cost out of pocket and likes having the option to save up for those health expenses later in life, like perhaps maybe after he's retired. Here are the new rates for the Saver plan. And that 40 million that UK is putting towards health insurance costs, that's going towards that total monthly cost, which helps what you pay as an employee. It'll be in that credit as well. That's what UK pays. Now into the HMO. The HMO has no deductibles, no copays for preventative care. It's only available if you live in Central Kentucky. You must use UK healthcare providers. New to the HMO plan this year, when fertility is now included. If you're considering the HMO, you want to consider that if you don't need medical care outside of the Central Kentucky, and you like the convenience of seeing UK healthcare providers. It's easy to schedule those appointments, maybe over a lunch break, walk over, get your appointment, and come back to work, and it doesn't take a lot of hassle to travel to the appointment. Here's an example for Steve, who has chosen the HMO, has good overall health, does do the routine services such as the annual physical and flu shot, lives in Lexington, works at Kentucky Clinic. And what Steve likes about the plan is that convenience of being near his providers when he has appointments during the day, and he likes those low co-payments for services. Here are the new rates for the HMO. Now on to the PPO. This plan provides greater flexibility to see any doctor in the Anthem network. You have higher monthly premium, as well as deductibles and copays for some of the services. This does allow you a lower deductible and lower copays if you go to a UK healthcare provider. If you're considering the PPO, you want to consider that does you and your family need flexibility to see different healthcare providers? Maybe you are okay with seeing UK providers, but now you have a child that's going to college and that's going to be out of state. This PPO plan is good to be able to fit that flexibility for you and your family. Here's an example. Megan, she has health conditions. She's established a relationship with a doctor outside of UK healthcare for a chronic condition. She lives in Lexington, works at Coldstream. And what Megan likes about the plan is that she doesn't mind having those higher deductibles and copays to be able to have more choices in where she receives her care. Here are your new rates for the PPO plan. And now into the RHP, designed much like the HMO in that you have no deductibles or copays for preventative care. Only available if you live in the state outside of Central Kentucky. You must use UK healthcare or Anthem providers outside of Central Kentucky. You want to consider, again, your address drives the plans that you're eligible for. So if you live outside Central Kentucky but don't need care out of state, if you're going to go out of state, then you don't want to choose the RHP. You want to look back at maybe a PPO. An example for someone choosing the regional health plan, we have Gail, who has health conditions, are good overall. She lives in Pikeville, so not in Central Kentucky, works at the Agricultural Extension. And what Gail likes about the plan is that she doesn't live near UK, so she's not able to go to UK healthcare providers, but she likes the coverage that has no deductibles and low copays. And here are your premiums for the regional health plan. And now for the EPO. This is your greatest flexibility to see any doctor in the Anthem network with no deductibles. Again, designed a little bit like that HMO and RHP. You want to consider this if you anticipate that you or your family are going to have a lot or highly specialized healthcare needs. An example for the EPO, we have Richard, health conditions. He has a spouse that has a chronic medical condition that often requires multiple hospitalizations a year. They've established relationships with providers outside of UK healthcare. Live in Lexington, works on campus. And what Richard likes about the plan is that he's okay with paying that higher monthly premium, but it offers that wider range of providers to choose from, no deductibles or co-insurance. This is our most expensive plan, as you can see. Now into flexible spending accounts. Again, open enrollment. If you are already in a flexible spending or you want to re-enroll or you want to enroll for the first time, each open enrollment, you have to make that election. Otherwise, the plan stops at the end of the fiscal year. We have a new vendor this year for our flexible spending. That is Task, and you will be issued a debit card. And the card, what's different from ASI is that you can use that debit card for both the dependent care and health expenses. So that's a big change. If you have unused funds with ASI, those will move over to Task. The maximum contribution amount is $3,200. The minimum is $250. That's for the healthcare expenses. Dependent, that is a minimum of $500, a maximum of $5,000, and that's per household. Just to mention, with that healthcare FSA, that does allow you to cover any eligible family member in your household. Even if, say, your spouse is with another employer and they have a deductible or co-pays with their employer insurance, you can still utilize your FSA money in that instance. Can your funds roll over? Yes, they can. $610 for the healthcare FSA. There is no rollover for the dependent care, but there is a grace period for the dependent care.
Tina, we have a question regarding the task cards. When will the new cards be mailed?
They should be mailed, and everyone should receive them, hopefully, prior to July 1st. Additional benefits. All of UK health insurance plans do have additional benefits. Hinge Health is for back and joint health. Win Fertility, that's for fertility and family building benefits. Again, earlier on I mentioned it is now available with the HMO. Inclusive Care, this is for help navigating care options. Wonder Health for clinically proven weight loss support. Building healthy families for personalized prenatal through post-pregnancy care. And then digital emotional well-being tools from Anthem. You can also access HR's work life and well-being offerings at any time. For mental health, we have in-person and telehealth appointments with a therapist at no cost. Those are 5 per fiscal year. Personal finance, Cap Trust is partnered with us to offer financial advisors. There's support for budgeting, retirement planning, student loan forgiveness, and saving for college. Nutrition, we have dietitians that can help you with personalized programs. We have community supported agriculture vouchers. For personal resilience, we have health coaching, tobacco cessation, Headspace. For physical activity, 3 fitness memberships, group fitness classes, exercise specialists, steps challenges, and Move Well rewards. For working parents, there's the ability to network with other working parents, find summer activities, connect with a student for occasional child or pet care. So we don't want to leave out those 4-legged children. Elder care, meet with an elder care specialist. There's monthly support groups. So if you're a caregiver, that's a tough job. There are support groups out there. where you can talk with other caregivers and find that you are not in that boat by yourself. And we also, through Elder Care, they have several educational webinars. If you have more information, you can go to hr.uky.edu/well-being. Dental and vision insurance. There are no increases to dental and vision. We still have the same plans. We have UK Dental and Delta Dental. Each vendor offers two options. UK Dental, we have your basic and your comprehensive. And with Delta Dental, we have a basic and enhanced. Now, a common mistake made is oftentimes the UK Dental Basic and Delta Dental Basic are confused. They do have different levels of coverage. Your basic is just going to cover those cleanings and exams twice a year, where the Delta Dental Basic offers more coverage towards your minor restorative procedures. Vision plan is still administered through iMed. You have two options there. You have the iMed Essential and the iMed Enhanced. Both plans include one exam per year and the purchase of lenses or contacts every 12 months. They do differ in frame purchase options. So the Essential, you can get frames every other year. With the Enhanced, you can get frames every year. You'll also want to look at if you are seeing a preferred provider with iMed, the annual allowance that you're provided under each of those options can increase by $50. An example of a preferred provider would be Lens Crafters. Other insurance options. Open enrollment is also your opportunity for these other services, such as the legal services. It's a cost-effective way to help with wills, contracts, family law, and other legal matters. You have the option for just for you or for family coverage. Short-term disability. This is a great option if you're considering having a child. Cancer and disease specified insurance. Universal life, guaranteed issued up to $125,000 without answering any medical questions during this open enrollment. That plan is portable, so you can take it with you if you leave or retire from UK. You just would have to reach out to the MPM group and they will give you directions on what you need to do. There's also critical illness insurance. Now, all of these plans that I mentioned on this slide, these are all offered through the MPM group. So you're not going to find them through the employee self-service portal. The MPM group has a portal of their own that you will want to make sure that you log in there and take a look. There's claim forms available from their website. And if you have questions, there's those 10 open houses where you can speak with them directly and find out what rates may be for the plans that you're interested in. Do you have questions? I'm sure that you're going to. If you don't today, probably as soon as you sign off, one's going to come up. The good news is you can reach out to us. You can look on our website. You can call the benefits customer service front desk. You can contact us via email at our benefits email. Again, new this year is the ability to schedule a 15-minute individual consultation. If you need the support beyond today or beyond initial phone call or email, we have the webinar which is, of course, today. And then the other one is going to be from 3 to 4 p.m. on April the 23rd. We have those 10 open houses where you can find the dates and locations on our website. And then we have a virtual open house with the breakout rooms for benefits and our other vendors on April the 24th from noon to 1.
Okay, Tina, we do have some few questions that I wanted everyone to hear. Do we enroll on open enrollment website listed earlier or on the site where the benefits are currently listed?
You will want to enroll by clicking on the employee self-service button. Then you'll click on benefits and payment. And under that benefits and payment, you should see an option that says open enrollment. That's where you want to go to make changes to your benefits.
And will they, this is another question, will they be at the Student Center on April 22nd? They will. They will be at the Student Center from 10 a.m. till 2 p.m. in Ballroom C. So another question is, can I buy vitamins and other non-prescription drugs with my FSA card?
No, they do have to be prescribed. For instance, the doctor prescribes you vitamin D. As long as you have a prescription, the vendor will require additional documentation, and you would have to send in a note from your doctor saying that they have prescribed them. That is the only way to do the vitamins.
Another question is, under personal finances, finance benefits, how much college funds are available for a spouse who wants to study at UK?
I'm assuming you're talking about the family education program. The family education program, after you've been at UK for 1 year, you get a 10% discount. Each additional year, based on your hire date, you receive an extra 10%. It goes up to, after 5 years, a maximum of a 50% discount. Now, that is for classes only at UK, and it is for undergraduate level only. And it's a discount on tuition. It's not actually an amount. So it's going to depend on how many hours that the student's going to take.
And then, is the online health still a no copayment for use?
That is correct.
Yeah, I do see a few people have their hands raised. Unfortunately, we can't unmute you, but you can ask a question in the Q&A. If we are already enrolled in Fidelity Retirement, how do I enroll in TIA as well?
You can do this by going to your employee self-service portal. Now, for retirement changes, this is not an open enrollment election. You can make changes to your retirement elections anytime during the year. The only thing you're going to be limited by are payroll deadlines as to when you're going to see that change effective. So if you want to make a change today, you can go to the employee self-service portal, click on benefits and payment, and then you're going to see two options there. One's going to say matching retirement or mandatory retirement, and the other will say voluntary retirement. So if you want to make a change to that matching plan, when you click on that plan, it's going to come up and give you the options for the two carriers, TIAA and Fidelity. Then what you will want to do is you will, if you want to split it, you're going to have to change the one that you're currently enrolled with and then begin and put in the amount that you want for the second one. And if you need help with this, please use one of the options that we have available. Call our benefits customer service desk. We can walk you through that over the phone, or you can schedule one of those 15-minute individual consultations.
So RHP is the same as HMO, except for those living out of the central Kentucky area.
That is correct. So the HMO is Fayette County, the surrounding counties. The RHP is all of the other counties in the state of Kentucky. And if you have the RHP and you're in the Lexington area, you're not going to be able to utilize that at, say, Baptist Health or Lexington Clinic. If you're in the Lexington area, you would have to use UK providers.